Welcome to today's press briefing. We have on the stage two doctors. Principal Medical Officer Dr. Ao Wing from Head of Communicable Disease Branch, Central Health Protection, and Dr. Lee from Hospital Authority. Good afternoon. I'd like to report on the updated COVID-19 situation as of the 12th of June. As of yesterday, 305 PCR positive cases were recorded, including 44 from the Hospital Authority, 20 from the Public Health Laboratory Service, and 241 remaining reported by private laboratories. And we also recorded 432 RAT positive cases successfully declared on the platform and confirmed further via PCR tests. So altogether, we recorded 737 positive cases in Hong Kong, and cumulatively, so far, we have 1.2 million and 7,000 cases since the fifth wave. And among the cases reported, we recorded 104 imported cases and also 33 local cases. And among the imported cases, 54 were picked up at the test and hold center at the airport, and 8 cases arrived in Hong Kong on the 11th of June, and also 40 others arriving on the 12th of June, and some 40 cases were picked up in quarantine or isolation facilities. There are also 9 other cases picked up after 7 days of quarantine in a hotel in the community, including 3 cases testing positive after leaving quarantine hotels. And these cases were departing Hong Kong, and at the time of departure, these cases tested positive with high CT values. Subsequently, they also tested negative. We believe them to be repositive cases. We have 3 cases on the 12th day and some others on the 11th day picked up. And among them, 2 cases had CT values above 30, believing to be repositive cases. There are also 4 other cases with CT value below 30. We're going to conduct analysis to see if these are repositive cases or local cases. As for residential care homes, we recorded 1 additional case in an RCHD, that is Yue Kun Ji Ga in Yukong Road, Aberdeen. The outbreak concerns 5 cases, and all tested PCR positive as arranged by the Social Welfare Department on the 12th of June. And 3 cases resided in the same ward and 2 other cases in the other ward. These residents could roam freely in the community, either to work or to have other activities. We believe that they were infected in the community, leading to this outbreak. There are 41 residents in this care home. As for the remaining 36 residents, we have arranged for them to be quarantined in Asia World Expo. As for schools, this morning we received altogether 275 positive cases reported by schools. 220 cases were reported to us this morning. As for 55 other cases, they had reported to us over the weekend. As for the 275 cases, they involve 193 schools with 216 students and 59 teaching staff. And upon investigation, we have found that clusters have emerged in 4 schools. The first one is in North District, Zhenghui Qinhei school with 4 cases. And we have recommended suspension of classes. The second is Dukbo Chinese and English kindergarten in Wangpo Garden. In morning classes, 3 students tested positive, and we have advised suspension of classes this week as well. The third case is Bradbury Kindergarten in Tuen Mun Baptist Church. 2 pupils and 2 teaching staff from 2 classes tested positive. Again, we have advised suspension of class. The 4th one, International College in the North District, in class 9.3, three students tested positive. We have advised suspension of classes. For Island School this morning, they reported 6 teaching staff testing positive. And on investigation, we found that these 6 teachers last week attended a conference or meeting. So altogether, there were 15 teachers present. The remaining teachers are now listed as close contacts, and they will be subject to home quarantine. As for schools involved in clusters, we earlier announced, including Poland, Cook, Lam Chen, Merman Chen English Primary School. There is another case in class 4B, another in 6A. These classes have now been suspended. The other is in Chunwan Joyful World Kindergarten. We have recorded 2 more cases in one class, PN Jungle, the morning session, and we've recommended suspension again. And as for class 2C of Pui To Primary School, we identified a cluster, and today we've recorded 2 additional cases. As for death cases, we have not registered new cases today, and cumulatively, the total death count in the 5th wave remains at 9,177. As for bar clusters, for the Rex City cluster, we have recorded 3 more cases. All of them are patrons. And so far, 21 cases have occurred for this cluster, and the infection rate is about 26%. For FLM, today we have recorded 7 more cases involving 6 patrons and 1 staffer, and so far 24 cases have emerged in this cluster involving 22 patrons and 2 staffers. The infection rate is about 18%. As for whole genome sequencing, the Public Health Laboratory Service yesterday analyzed some suspected BA.2.12.1 cases, altogether 12 of them, including some cases suspected to be of this subvariant or having connection with other confirmed cases. 2 of them are important, and 19 others are local cases. There are 4 cases having linkage with previous cases, 2 relating to Loshan Court in Taigushing and 2 in Chengguan-O Warfai Court. As for the remaining 12 cases, they are of unknown sources. 3 cases belong to the same household. They live in Wingfu Court, Tin Shui Wai, and also Sei Hai Daihai in Lockhart Road, a 2-person household with 2 cases. Chongyin Garden, Tower 1, Tung Choi Street, Mount Kok, and also the close contact lives elsewhere. And there are 2 cases of this nature in Fuk Wing Street, Sun Wing building, and also Residence Oasis Tower 10 in Tuen Mun. Another case in Boundary Street, number 33, Hang Sun building. Another case in Mangon San MOS Block B, and another case Kwai Zhen Yun Kwai Chung Block C, and the last case Lower Wong Tai Sin Estate Long Dat House. And these cases will be subject to compulsory testing notices. We've also identified among these cases that there are 3 workers working at the same construction site. These 2 of the cases are suspected to belong to BA.2.12.1, and the location of the construction site in Central Kowloon Road. They live in Chun King Garden, Chun Wan, and Mang Kong Wo Tong Gong in Sai Kung, and Lei An Building in Wong An Lei. As for BA.4, BA.5 subvariants, there are 6 more cases, 4 of which are imported cases. As for the remaining 2 cases, they are local cases. Now, the first local case, we announced earlier that there was a case relating to a housekeeper of Regala Sky City Hotel, Tung Chung, and this case is a family member of that confirmed case on the 7th of June. This family member was sent to the quarantine center on the 8th of June, and the case was confirmed. Another family member also tested RAT positive. And so the other local case, The case is a 42-year-old female working as a cleaner in a Regala Sky City hotel. She lived in Chun Mun, Leung King Estate. And as for the PCR RAT test, she tested positive for both tests with a CT value 21. She is subject to regular testing. So on the 6th and the 9th of June, the test results were negative. On the 10th of June, she started to exhibit the mild sore throat. She has had 3 jabs. She is usually responsible for cleaning hotel rooms, and she also done protective gear, and she went to Ngao Hei in Hongzhou on the 8th of June, and this place was subject to CTN as well. We also received another case relating to a cleaning worker in Regala Sky City Hotel. We have not conducted a gene sequencing analysis. She's a 39-year-old female. She lives in Chun Mun. And she last attended work on the 11th of June, and she started to exhibit symptoms on the 12th. And the PCR test conducted on the 11th was positive with CT value 35. She previously tested on the 6th, 8th, and 10th with negative results, and she had contact with the cleaner I just mentioned, and they had masks on, and they had a similar kind of work. Dr. Lee will report on HA situation. We have 371 confirmed patients in our hospital system, including 44 newly confirmed cases. As for those requiring isolation facilities, 112 are in isolation wards, 9 in second-tier wards, 48 patients are receiving treatment in the North End Hospital Hong Kong Infection Center. 33 of them are newly confirmed cases. As for newly reported cases yesterday, we did not record anyone in critical condition or serious condition. As for inpatients, so far, we have 15 critical patients and 7 in serious condition, and 3 critical patients are receiving intensive care. We have not received any death cases reported as of yesterday. 32 patients have recovered as of yesterday, including 27 who's been discharged. And since the 5th wave, so far 50,899 have recovered, including and 50,516 have been discharged. And since the beginning of 2020, 63,207 patients have recovered, including 62,896 patients who have recovered. We have not recorded any patient testing positive via admission screening, and no close contact has been identified. As for staffers, 23,677 have so far been infected, and 23,601 of them have recovered and returned to their positions. We'd also like to report cases concerning the United Christian Hospital, 3 nurses and 1 other staff, and the psychiatric department of UCH. As mentioned, 3 nurses and the worker have been infected with COVID-19, and they tested RAT positive yesterday, including PCR tests as well, and contact tracing has commenced, and we found that the nurses have had the gatherings. The nurse had the gatherings with other staff, so we have 2 more nurses and 1 supporting staff confirmed today, and there are also 23 other colleagues being subject to quarantine. They're listed as close contacts. The 3 nurses are responsible for outreach services. Clinical services in the hospital are not affected, and no patient has been listed as close contact. The UCH will continue to closely monitor the health condition of staff members and will continue to liaise with the CHP. We once again remind all healthcare staff that in light of the serious epidemic situation, you should refrain from meal gatherings. And even if you have gatherings, you should avoid having conversations during meals and keep your mask on once you stop eating to avoid transmission. The floor is now open. Please use the mic when you speak, and before you speak, please introduce the media outlet.
The lady on the front, H801. About the Regality Sky City. So according to the assessment of CHP, is there an outbreak there? After CHP's assessment, do you consider the staff there would be infected by those who are in quarantine there? Have you checked the ventilation there? Is it similar to any quarantine hotels you checked before? So what's the cumulated number of infections in that hotel? So we know the BA 12.1. We know there are 19 untraceable cases. We know 3 comes from construction sites. Will you order for suspension of that site? And we know the 2.3% released by HKU. Is it does that signal the start of the 6th wave? First, about the Sky City Hotel. The first case is on the 7th of June. It's a room cleaner. It's the first case there. So we asked that cleaner whether he or she was in touch with any hotel guest that was in quarantine. And he or she admitted that when requested to deliver stuff to the rooms, they would do so, but with PPE on. So we do not rule out the possibility of them, of the staff getting contracted by those who are in quarantine there, the guests that are in quarantine there. And in the meantime, we have found 10 hotel guests who are found infected in the hotel, and all are imported cases. We're now doing the genome testing and genome sequencing to confirm whether the infected staff got the infection from the hotel guests. And in the 8th of June, we demanded the hotel to have all of the AET staff to have all COVID testing, and all results turned out to be negative. And we are now notified of the 2 new cases there. And in one case, it's only turned positive on the 10th of June, but is still negative on 9th. So we can see they are having COVID tests daily. And this case is quite different from the first, because this staff member is responsible for cleaning within the room, and he or she is not in touch with the first infected case. So we are still, the source of infection is still unknown. And last week, we have worked with the Mechanical Services Department and the Housing Department, and we checked the hotel. We've done an assessment of the balance of the airflow within the rooms in the hotel, and we have identified some issues with that, and we demanded the hotel to follow up on that and to have PCR on all staff. We have made this amendment today, and we also have epidemiological relevance between those cases. And about the BA 12.1 strand, we believe it is being found, this strand is being found in different places within the community. We know the first case was found, it's a couple from the States, which was found on the 12th of June. And for now, we have 140 locally infected BA 12.1, and 40 is from the McDonald's group, and 14 it's from the exhibition center in Wan Chai, in the cafeteria there. And for the rest, at least 40 were untraceable, and it's like spread within 15 places in Hong Kong, and they don't seem to be related. And for now, we don't see the cases being centralized in particular areas, but it seems to be spread out throughout Hong Kong, and they seem to be also related to other cases for which the sources are identifiable. So there may be chains of infection that are already within the community. So once we have identified those cases, we would put them in quarantine, and for those who are in close contact or the family, they would also be sent to quarantine centers. About the construction site, it's in Ho Man Tin, Fat Kong Street. It's the central highway construction. There are at least 3 cases there. We believe the 3 cases, those 3 people, they know each other, or they ate together for meals. And from what we know, the changing rooms there can be shared between like 5 to 6 people. And about the real-time effective reduction rate, today is surpassed 2%. So it indicates the increase in infection within the community, and this rise is also vindicated by our increasing daily COVID cases. And other, for example, the sewage samples or the community testing centers, the positive cases that have been returned through these sources are also on the rise. And it can be said to be within our expectation, especially following the relaxation of the COVID measures. But for the ICU rate or serious or critical cases, they do not seem to be on a significant rise for now, but we will continue to monitor those figures. Cable news. I want to follow up on the 3 cases in the construction site. When the workers are working, do they put on their masks? And we have seen the cases are now on a rise to a daily tally of 700 or 800. Is it the start of a new wave? Can you?
About the construction site cluster, we only received information last night, and we're still in the process of investigating into the cases. The two of the 3 cases know each other, and they are aware of confirmed cases at the construction site, and that's why they get themselves tested, and they share resting rooms, changing rooms, and other facilities at the site. Further investigation is needed to find out exactly how many close contacts there are and whether their close contacts are also confirmed cases. We've advised the construction company to make sure to ask the whole team to get tested. As for the epidemic situation, as mentioned previously, among the various indicators, we have noticed that in the past 2 weeks, there is apparently an increasing trend. So we will continue to monitor whether this upward trend will continue. The surge in cases reflect the fact that in the community, we are having more transmission chains, and that accounts for a surge in the number of cases. As for whether this upward trend will continue, further monitoring will be necessary to see if this continues. Meanwhile, we also need to pay attention to the number of death cases, and so far we have not noticed any increase. And on the whole, we do have a certain level of immunity in the community. Now, many Hong Kong people who have been infected in the 5th wave have not been jabbed afterwards. They've only got the relevant QR code for recovered persons, but then 3 or 4 months after they've been infected, their level of immunity may drop. which means they may get infected again. So I appeal to everyone who hasn't been jabbed to get jabbed as soon as possible. English question.
Two questions from the South China Morning Post. The first question is to ask about, just given the recent rise in the number of cases, is there a need to further tighten the epidemic control measures? And the second question is to ask about, would there be any measures that would specifically target bars and clubs, given that these are where the recent outbreaks are coming from? Thank you.
Thank you for your question. For the first question on the increasing number of cases reported recently, we noted that from various parameters that there is a rise in the disease transmissions in the community. This is quite obvious, and the number of cases has risen from about 300 about 2 weeks ago to 700 to 800 in the recent few days. So this signifies that there is increased transmissions in the community, and this is as expected as we have loosened some social distancing measures and people are resuming their normal life, and there are more and more interactions between people and also more gathering. So we will closely monitor. The most important thing is we have to ensure that there is no increase, or we need to monitor the trend of severe diseases and also hospitalization and number of deaths. And so far, we haven't noted a continuous increase in these parameters, which indicate the burden on our hospital, on our medical system. For the bars and clubs, there are quite a number of outbreaks, and through our epidemiological investigation, we try to identify these outbreaks and also implement some control measures. For example, compulsory testing, so as to detect the cases, and also implement some control measures in these bars with outbreaks.
Next question. I'm from AM730. About Regala Sky City Hotel, there are 2 cleaners involved. Do they clean all hotel rooms in the hotel or just focus on the number of floors? About 15 cases being imported cases during the same period of time. I understand analysis has been conducted. Would you say that other cases are infected as a result of transmissions of these 15 cases? For the 3 workers at the Central Kowloon Road, the site, what nature of work are we talking about? And do you think the transmission has to do with ventilation? Has it to do with the sharing of facilities or airborne transmission? As for RTD operations, you said that according to sewage surveillance samples, there is an increasing trend. But for the cases picked up via RTD operations, it seems that the number of cases are dropping. So can you tell us more about the criteria for selecting areas for RTD operations because of the proportion of infected cases picked up? As for restaurants announced in the CTNs, is it because the confirmed cases have visited these restaurants? For the 2 cleaners in Regala Sky City Hotel, as we understand, they would enter hotel rooms for the purpose of cleaning, but they would first make sure that the guests subject to quarantine have left the rooms. So by the time they enter the rooms should be empty. So there should be no contact between the cleaners and the guests. But further investigation is necessary to find out whether the transmission is carried out between the worker previously infected and the 2 cleaners. 10 guests were infected in the hotel early this month, so we would compare the genome sequencing results, because for the first case, the staff would need to deliver some items to guests under quarantine, and it was possible that whilst in the corridor of the hotel, she got infected via airborne transmission. As for the construction site, so far we have identified 3 cases only. As for the actual number of cases in this site and also the total number of workers in the team, we need further investigation as well. For RTD operations, we go by 2 criteria. First, we check in a district whether we see concentrated cases occurring in certain residential buildings within a short period of time. And if the answer is in the affirmative, we may conduct RTD operations. Second, we also looked at the sewage surveillance data. And if we find high concentration of viral load in certain residential buildings, we'll also conduct RTDs to identify asymptomatic cases. And in fact, in recent operations, we have been able to identify a lot of cases in a single building. In some other instances, we haven't been able to identify many cases, but it doesn't mean that our operation is futile. Last night, we conducted RTD operation in Gingman House in Ho Man Tin, and we picked up over 10 cases. So that proves the result of the operation and that we could intervene at an early stage, and for residents to be sent to isolation centers as quickly as possible to prevent further transmission.
Gentlemen, please, for Ming Pao. The real-time effective reduction rate is surpassed 2%. So how do you assess this wave of outbreak? Is it the 6th wave coming? So is it related? This rise we've seen recently is related to the bar clusters, for example. So again, have we already stepped into the 6th wave? Do you have any parameters for determining where the 6th wave have come? Do we need a new variant, or do we have to draw a line when we can really have a 0 COVID case before the new wave can begin? So is it the BA 2.212? And about the Sky City, we know the family of the one staff member have been infected. So today's local cases, the exact number, I just want to clarify. And the cleaner and the room staff, do they have genome sequencing in terms of that? Are they related cases? So first, about the trend of our pandemic, we undoubtedly have seen a rise from around 300 cases to up to 800. So our other parameters, indicators also corroborate with the rise. So it would perhaps be of no surprise that the number will ultimately go beyond 4-digit again. So we believe this rise is relevant to the relaxation of COVID restrictions. And as things start to normalize, people would interact or gather more often than before. So there's just a higher risk of infection because there are still chains of infection within the community. So as people are getting together more often, and it's just maybe natural for more cases to arise. And as we know, Omicron is also highly contagious. So these are all the factors that explain the rise. But the herd community in our community also contributes to the lower number of severe cases. As to the elephants with the bar clusters, as with all other clusters, it indicates some outbreaks in particular areas. We continue to appeal to restaurants or other high-risk areas like bars. They should ensure customers should wear a mask when needed. as we know, after the fifth wave, the cases has not dropped to a very low level. It's been hovering around 200 to 300 cases. So it indicates there's still chains of infection in the community. So we have to continue to monitor the trend. As for the homes for the disabled, we are still waiting for the results. Once we have the results, we do genome sequencing to see whether it's BA 2.2. Is it this variant? But from what we know, all of them have got vaccinated. From the number that I have, let me see. Within 41 who reside in the home for disabled, only 18 have got 2 doses and 3 only got 1 dose. As for the BA 4.5, this variant, for this variant, there are 2 new local cases, including the room staff, we just mentioned in Sky City Hotel, and 1 family member of that staff member is also infected. But we cannot confirm the variant for that family member yet. As for the cleaning staff in Sky City Hotel, is also the variant BA 4.5, and the remaining 1 case from that hotel, the variant is still unknown. And for the complete genome sequencing, we're still waiting for the results. Economic Times. I want to have a question about the construction site in Homentine. We have Kingman House and etc. These houses. Is there an outbreak in Homentine? As for the imported cases, for 2 days is over 100 cases. Do we feel a high risk from imported cases? As for those who are negative but turn positive again, is there a trend for that? As for the staff in UCH, is any family or staff closely in touch with that staff member? And for the Wan Chai, there's a place that has reported few cases. First, respond to the Homentine construction site, the issues with that. So far, only 3 cases were found. It's not yet a significant outbreak, but we will continue to monitor the situation. We believe the 3 persons there who are infected, they may have shared facilities or have had meals together. But for now, there doesn't seem to be an outbreak there. As for the BA 2.12.1, this variant, we have been seeing more and more cases from this variant. And it's not restricted to certain areas within Hong Kong, but seems to be spread out throughout the territory. It's in Hong Kong, Kowloon, and New Territories, and come to a total of 40 untraceable cases. And another 40 epidemiologically related, spread out in different districts within the territory. So it seems to have shown this variant 2.12.1 has a rather significant sphere of infection within our community. As for imported cases, there has been a rather significant rise in imported cases in the past few days because the daily number of arrivals in Hong Kong have been on the rise as more tourists or visitors are coming. It is almost naturally that more imported cases will be found. But we also have measures in place for controlling the imported cases and the situation for that. And so as for the Wan Chai outbreak, usually we would, once we identify cases, we would arrange for PCR the day right after. So there should not be a significant delay in getting the cases with a PCR confirmation. So this is about the negative cases which turn positive again. As for the one-shot situation, I don't have much information. As for the UCH situation, I give to Dr. Lee.
3 nurses and 1 supporting staff have been confirmed in UCH. You ask about the supporting staff, and all 4 cases work in the same department, the psychiatric department, and they're responsible for outreach services. We'll take the last question over there. Good afternoon. Now, you mentioned a cleaner in Regala Sky City Hotel under BA.4.5 subvariant having activities in the community. How do you assess the risk of transmission in the community? And how do you assess the transmissibility and the seriousness of BA.4.5 as well FLM bar? 1 more staffer has been infected, and what is the nature of work of this staff? And did the staff take the mask off during work? And according to experts, the number of cases may go up to the 4-digit figure. If that is the case, is it necessary to tighten the social distancing measures, and what are the applicable parameters for doing so? For BA.4.5, there are 3 cases in Regala Sky City Hotel. So far, we've identified 3 staffers in being infected with BA.4.5, and once we identify these cases in the community, we conduct analysis as well as investigation. First, we would arrange for cases to be sent to isolation facilities and for household contacts to be subject to quarantine in the relevant facilities. And if they have visited high-risk places such as restaurants with mask-off activities, it will be subject to CTN as well. You may recall at the beginning, we subject 1 restaurant to CTN as well. And so far, no other cases in the community have been identified. But then 2 family members of 1 case have tested positive, and also the building where they live is subject to CTN as well. And if we identify more BA.4.5 cases in the community, and during infectious period, if the case has activities in the community, then definitely there is a risk of transmission in the community. So for local cases we conduct genome sequencing for every case to check against BA.5 or BA.4, and if that is the case, we can implement measures as quickly as possible. For the additional case in FLM, I don't have information at hand as to the nature of work of the staff member. I will give you more details later. In FLM, for the cases picked up therein, we've found that there were activities in the bar where patrons would take off their masks, and we believe the cases emerge as a result of mask-off conversations and between patrons and other activities. As for social distancing measures, I believe the governments and experts would closely monitor the situation. Indeed, there is an upward trend, but according to experts, we'll also need to have regard to, say, the hospitalization rate, the rate of serious cases and death cases, and so far we have not registered an increase. That's the end of today's press briefing. Thank you.